All right, welcome to the Gut Feelings podcast. So, today we have a really special guest. We're really honored to have someone to speak specifically about gut brain connection and the different tools that are available for people with gut disorders like IBD. So, today we have Dr. Navidi, who is a licensed clinical psychologist and co founder of GI Psychology, specializing in GI disorders and chronic pain. He oversees training and outreach at the practice. Dr. Navidi is the founder and past president of the Northern Virginia Society of Clinical Hypnosis. He has given national talks at institutions like UNC School of Medicine and Georgetown University, as well as on various podcasts and TV. His work has been featured in the Washington Post and the Atlantic. Dr. Navidi has developed a partnership program with Georgetown University Hospital for patients with GI disorders. He led the development of a partnership between GI Psychology and GI On Demand, a platform connected to over 17,000 gastroenterologists where GI Psychology will be the preferred provider of gut brain therapies. So, welcome to the podcast, Dr. Navidi.
My pleasure. Thanks for having me. I appreciate it.
Yeah, we're so honored to have you. So we actually got a chance to learn from Dr. Navidi and his team a lot about how gut brain therapies can be helpful for our patients with IBD and other gut disorders. So it's an absolute pleasure to have you. You're one of our first interviews so far, and we talk about the gut brain connection all the time. We talk about because our name of our podcast is gut feelings, so we talk a lot about our own experience. So it's such a pleasure to have you. So thank you for being here.
My pleasure. Yeah, I'm looking forward to this. Let's get started.
Yeah, sounds good. So Danielle, do you want to dive into our first questions?
Absolutely. Yeah. So, Dr. Navidi, I can't remember if Ashley and I said this the first time we chatted, but both her and I have IBD, and that is one of the big reasons why we got into dietetics. We wanted to be able to relate
Yeah,
to the people we would work with. And I mean, hey, it kind of has a big impact on our life. So we wanted to share that with other people as well. So we were wondering, like, how did you get onto the path of becoming a GI psychologist? What made you choose this specialization, if you don't mind sharing?
absolutely. And also thank you for sharing. I actually didn't know both of you have IBD. And immediately, the GI psychologist in me has so many questions about your own experience too. I don't know if we'll have time for that, but if we do, I'd love to ask more about that. How I got started was I kind of fell backwards into it. Um, I um, I was actually a microbiology major in college, and I was working in biotech. Afterwards, I was doing yeast exocytosis. We were studying yeast exocytosis, and then we were studying Alzheimer's genes. And I was about to go and get a PhD in biochemistry. And luckily, my wife is much smarter than me, and and she, noticed, I'm spending all my time reading all these psychology books. I'm playing at amateur therapist to friends and family, and said, "Hey, you might as well do something that you really have a lot of passion for." And so that's how I ended up in psychology. And what really brought me to psychology was a love of clinical hypnosis. And I discovered that as a tool, and I thought, wouldn't it be amazing to have a job where I get to teach people, about this tool, just as part of my day. Um, so I really didn't know at the beginning that there was this incredible connection between clinical hypnosis as a tool and treating GI disorders. Completely ignorant about that. I just loved it as a tool, and I took all the trainings I could find. And one of those trainings was clinical hypnosis for GI disorders. And I really didn't think I would ever use it. I was like, oh, this is interesting. and I kind of put it aside. And then I had a patient or two, I had a patient and I tried it out. Um, and we had these great results. And then I did it with another patient, and then doctors started finding out, and I started doing more. And the more I did, more I wanted to learn. So I started doing more trainings on it and learning everything I could. And before I knew it, fast forward through the years, and it was like 80% of my caseload, I was working with patients with GI disorders. Um, so I'm really an odd duck in the field because I kind of fell backwards into it. And look, there aren't too many GI psychologists in the world at all. I think last count is like 400. We're talking in the world. So not very many. And most of them are coming from, kind of university medical centers. So, like University of Michigan, we've got this great partnership with Dr. Megan Reel. Like she's an example of a GI psychologist. She's at their university medical center. You know, UCLA and all these other places. They've got GI psychologists, like one or two, three. Maybe if they've got a big program, they got four. Um, but on an outpatient basis, the kind of things that we're doing here with our practice GI psychology, it's it's pretty rare. It's pretty rare. So that was a lot of words to answer your question. I'm sorry.
No, no, that's okay. It's okay. One, it's really cool that your wife was able to see that in you and to
Yeah,
help be that little push to
yeah,
ultimately do something that, you're informing us about and I'm sure helping a lot of people. And another thing too, I did not realize that it was so niche. I mean, I knew it was niche, but I didn't know it was such a small community.
yeah.
Now, Dr. Navidi, could you explain to the people listening too, what exactly is GI psychology for people who aren't familiar with it?
So so that's a tricky question because GI psychology is the kind of one of the names of the field, and it's also the name of the private practice that we started, myself and a partner, 4 years ago.
Mhm.
So which one were you wanting to know about?
I guess maybe more so the specifics on like what a GI psychologist would do or a gut health psychologist would do.
Yeah. So a GI psychologist is someone who's you start off and you need to be a clinician and you need to understand how to treat patients in general. And then you kind of focus in, and then, you're going to probably have some training in health psychology, right? And then from there, you're going to go even further and understand, GI psychology. And a lot of that is understanding um, what we call the gut brain connection and how that can be influenced by what goes on in the brain, what goes on in the nervous system, how that can affect the gut. And those are our main levers. We're working through the nervous system, we're working through the brain to influence the gut and the various symptoms that people have throughout the system. Um, so that's kind of a very general explanation. And so there's a lot of very specific knowledge that a GI psychologist needs to gain in terms of understanding how the physiological systems are working. And then also, what are the specific techniques to kind of move those levers to help a patient utilize their nervous system, utilize their brain to influence their gut.
Mhm.
And I think it's important to put it like that because I think a barrier, and we were actually talking about this with a doctor and another psychologist earlier today. One of the barriers for a lot of these patients to get treatment is the idea of, well, I'm going to a psychologist, I'm going to a therapist. That means I have a mental health problem. That means I'm crazy. That means this is all in my head. Um, and that is actually not what we're talking about at all. There doesn't need to be any mental health diagnosis at all for someone to participate in this kind of treatment. And that's really important for patients to understand, is that they're not that there's anything wrong with having a mental health problem, but that's not the category that they're in. And that's not the lens that we're looking at them. We're looking at them in terms of how can we utilize what we know about the brain gut connection to kind of influence what is happening in their body. That has nothing to do necessarily with, a panic disorder or depression or things like that. Um, those things can co-occur, but they're not required. Does that make sense?
Yes, yeah.
Yeah, absolutely. And I think, Danielle, you and I kind of see some aspect of this on a regular basis with people that have IBD, and myself included. When you've had to go through the kind of stuff that we've gone through with food and you have to eat every day,
Mm,
sometimes those experiences can be traumatic or scary, or some people might have end up in the hospital because they had some sort of blockage, and then those foods that they had that day become scary. So there's all these different levels of fear that then you know
yeah,
as practitioners, we might see one end of it being like, well, these typically would be safe foods, but now they're associated as, scary because people have had these traumatic events.
yeah.
Can you give us an example maybe of how do you see all of this connecting and in your own practice and when you work with people and do an intervention? Like, what does that look like, and what are you seeing it being helpful for?
That's a great question. And so what that's really got me thinking of is that it's really hard to talk about IBD without also talking about DGBIs. So, in case people don't know, that's disorders of gut brain interaction, and they are not the same. So, as an example, DGBI would be something like IBS or functional dyspepsia, things like that, which is not IBD. However, a lot of the experiences that patients with IBD have leave them vulnerable to developing DGBIs. And I think of DGBIs can be caused. So, example, let's just take IBS for example. They can often be caused by multiple things. One of the things that frequently can cause a DGBI is trauma, and that's trauma to the gut. And if you think about the experience that someone with IBD goes through, very frequently there are these flares. And before the disease process is under control, you're going to have these flares more often. Um, and they go along with a lot of intense symptoms that potentially can sensitize the system um, to lead to what's called a DGBI. And one of the cases that I wanted to talk a little bit about is an example of that, where a patient with IBD also developed, on top of their IBD, they developed what's called like functional vomiting and nausea. Um, but absolutely, that process of getting sensitized to food can also kind of lead down that road for developing avoidant restrictive food intake disorder, so ARFID. Um, it can lead them to have actual symptoms when they eat that food, even if they're not in the middle of any kind of flare, even if their immune system is under control, they can still develop symptoms because their system's been sensitized, and there's that anticipatory anxiety, that hypervigilance, and that visceral hypersensitivity that can develop around that food or whatever that trigger is. Um, I don't know if I completely answered your question. So any parts that I missed, let me know.
Yeah, that's so interesting because I had never thought of it from that angle of just understanding the intricacies of what's actually going on, um,
Hmm,
rather than just the actual fear. But there's actually these physical things going on too that is making food often difficult for people.
Yeah. Yeah. And, you know, so as an example, you'll often see patients with IBD. Um, you look at all the tests, their blood looks good, everything is under control, um, but they're still having GI symptoms. Some of that can be due to potentially like past damage that's occurred right in their GI system, but also some of it can occur because of that sensitization that we're talking about, because they might have also developed a disorder of gut-brain interaction on top of the IBD, and that can occur because of, I think of it as like PTSD of the gut. When the gut, because you know they talk about the gut being the second brain, right? Um, and you imagine this brain has gone through this trauma, and it's going to react now, as well as the big brain, and they're going to be talking to each other. And when they're talking to each other in a very kind of anxious, scared way, you can get these effects where they feed off of each other in a negative way, creating more symptoms. And that's kind of like what we're talking about when we're talking about a DGBI, is when the brain and the gut start communicating in maladaptive ways.
Wow, that's interesting.
I know, I'm like just like trying to process that and like think of that in like my own situation too. I don't know if you feel the same way, Ashley.
Oh yeah, definitely. Definitely. I've definitely had a lot of those food experiences or traumatic experiences with IBD that, bring a lot of stuff up where you get like physical symptoms that seem real, or even just the fear of a flare up. For example, like you have a symptom and then you kind of start remembering past flare ups. And so you then, and even if you're not in an inflammatory flare, like your labs look
Yeah.
good, then you go down the rabbit hole of like, I'm in a flare, and you start actually experiencing all of the things that you normally experience with a flare up. And so that I feel like is one of the most complicated parts of IBD that we often encounter with people, is that disconnect of like, wait, I'm okay, but my body's not okay. I don't feel okay.
Yes. And that's, I think, often missed because IBD is such a physical disorder. You can see it in the labs, you can see it when you scope, you can see that there's a problem. People sometimes underestimate the role that the brain can play. And this is a brain gut interaction where the system has been traumatized, by these flares. And um, so you can get these effects where somebody has this. It's Think of PTSD in terms of flashbacks, right? Somebody's going through, and then there's a trigger. Something reminds them unconsciously of the trauma that they went through. And they begin to experience that trauma again at some level. It might not be as intense. They might feel the physical effects of it, they might feel the emotional effects of it, but they're being triggered to kind of feel it again in some way. And similar things can happen in terms of the brain gut trauma that people experience. And people with IBD are no different than anyone else who can also develop like a disorder of gut brain interaction. Um, so, just like you said, you've had these intense flares in your past, and then something gets you thinking about it. Maybe you're having a little bit of a symptom, and that to kind of the unconscious part of your mind, it reminds you of what it felt like when you had a flare. Your brain starts kind of processing it, and then you start noticing more symptoms. Even though you know your labs are good, even though you know the disease is under control, you're still getting those symptoms, and it can be very confusing. Um, but this is actually not uncommon in patients with IBD because we do have such a powerful brain gut connection.
Yeah, I'm glad we're talking about this, because I feel like it's going to be very validating for a lot of people that are going to their doctors and their doctors are saying, "Well, you look good, see
Right.
you next year." And, I think people can, with that knowledge gap of unawareness of that gut brain connection within healthcare, it kind of makes as the patient, it can make you feel like, well, I know something's not wrong. It can make you feel very unvalidated. So I think
Yeah.
just hearing that this is a real thing that's happening and it's very common, I think is just very, very validating as a patient to hear from a healthcare provider. So thank you for sharing all of that.
And those symptoms are real. They are 100% real symptoms. They're not in your head. You're not exaggerating anything, not making them up. Just because the cause is coming from your nervous system doesn't make them any less real. That's important to understand.
Yeah. So I think a lot of people are probably now thinking, okay, this really resonates. Maybe they're experiencing these type of things. So I guess first off, like what does the prevalence look like for how do you know much about how many people with IBD are experiencing, anxiety, low mood, PTSD, those?
So I think there's maybe two questions there, and I have um, I have one answer to that, which has some research to it, and then the other answer, which I really should know more about the research on it. So I see the one question is patients with IBD. What's the prevalence in terms of like comorbid mental health problems? So, are patients with IBD having more anxiety or more depression than kind of just the standard population? And the data shows that they are. I don't think we know whether it's a chicken or the egg. Like, does having IBD make you more likely to be depressed? That does not seem unreasonable, right? Does it make you more likely to feel anxious? That also doesn't seem unreasonable. Um, does something about the condition or the genetics or something like that make these people more likely to have anxiety and depression? I'm not sure. I'm not sure about that. But all we do know for sure is that more of them have this anxiety and depression than than if we just looked at the standard population. So that's the one side of it. So just from that, they're going to need more support, and very often, even when they're getting mental health treatment, they're not getting mental health treatment from someone who kind of understands a little bit more about what it's like to have the disease at all. Um, the second part is this whole conversation about disorders of gut brain interaction that can occur from the trauma of a flare, trauma of having IBD, the hypervigilance of wondering, when a flare might come, which is very natural. I don't know the data on that is essentially how often you get this layered problem of IBD with a disorder of gut-brain interaction on top of it. And just you asking that question, I'm like, I really should probably know that. So I apologize for that.
No, no, that's yeah. I think I remember we might have talked about it in a previous podcast, Danielle, but about the prevalence. Do you remember?
I'm not very good at pulling stats from my brain, but it's at least like 20% from what I remember.
I remember that too, 20 or 30. But we
Yeah.
can put it in the show notes too.
And
Yeah.
this is for DGBIs on top of IBD, or is this for the mental health side?
I think it
The
was. Oh, go ahead.
the mental health side of it.
Gotcha. Yeah,
Yeah.
yeah.
Yeah, I just feel like in all of this too, and Dr. Navidi, like with this podcast, we definitely are quite open, because we talk about poop all the time on here. But I just feel like just listening to you too, I'm just like in my feels right now as well, like processing, understanding, and just, relating to Ashley on what she said about flares and other things that may cause that anxiety. So, for those listening, I guess where I'm going with that too is just to know too, you are definitely not alone if you feel a similar way to what I stated. Um, we definitely see these kind of things pop up in our practice, and it's just really cool that there are some strategies out there to work through them. And like Dr. Navidi has emphasized, it's something that is absolutely just not in your head. Like these things are real.
Yeah, and
Yeah.
it sounds like there's a lot of hope for, just the different treatments that you mentioned. Like you mentioned you're very interested, or you originally got interested in the hypnosis side. So tell us a little bit about that.
Oh my gosh. Yeah, I could talk probably all day about clinical hypnosis. I think um, so on an overview level, the two major treatments that have a lot of research backing are clinical hypnosis and gut-directed cognitive behavioral therapy. And I add the gut-directed part because uh, general cognitive behavioral therapy is a really great treatment, but most practitioners are not educated about how to adapt cognitive behavioral therapy to patients with IBD, to patients with disorders of gut brain interaction. And so that's a caveat I put out there because I think a lot of times patients will have at some point had CBT, cognitive behavioral therapy, and they're kind of like, well, that didn't really help my gut issues. So so they maybe mistakenly are throwing the baby out with the bathwater, meaning they didn't really get gut focused CBT. So I wanted to kind of put that out there also. Um, but getting into clinical hypnosis, just out of curiosity, I know we already talked a little bit about this, but what was your familiarity before we talked in terms of this as a clinical tool?
Beforehand, for those listening, I wasn't sure that it was ever really used in the clinical setting. And that was
Yeah,
something we talked about too, where we remembered it being something being performed at a high school graduation, right? And it seems
yeah,
far fetched. But when we initially spoke about it too, it just, I don't know, I was like flabbergasted by it. And it is an exciting thing to learn more about. And I'm excited to hear what you're going to tell us about it.
yeah, absolutely. So that's the first part of any discussion that needs to be had about clinical hypnosis is we need to kind of separate things out, right? So we've got clinical hypnosis, right? And then we've got entertainment hypnosis. And one of my favorite comedies out there is a movie called Office Space. I don't know if you all have ever seen it, um, but the plot of the movie is driven forward by the main character's experience with hypnosis. And the premise is he goes in to get help from a hypnotist with his like stress, and the hypnotist halfway through, the hypnotist has a heart attack and just dies, um, leaving him in this like kind of trance state for the rest of the movie where he feels no anxiety and no fear at all, and then comedy ensues from there. um, it's a great movie, it's funny, um, but of course it's entertainment, right? And at least once a year there's some big movie that comes out that has hypnosis as the plot device, whether that's like mind control or some sort of mystical magical kind of thing that's happening. And so what I'd ask is just everybody just put that over there on the side and enjoy it for what it is. Enjoy it for the entertainment that it is. And then we can keep clinical hypnosis over here. And what is that about? That is actually fairly straightforward. It's about just helping and assisting people into getting into a trance state, right? To do that on purpose rather than accidentally, because as humans, we all go in and out of trance throughout our day. It's a normal part of life. I drive the same way every day. When I go to my office, and I have almost zero conscious memory of doing it because I'm in my book on tape or I'm listening to my music. My conscious mind isn't there. I'm in kind of an alert, what we'd call an alert trance state. When you're engaged in something you really like and you lose track of time and everything else kind of fades away, another example of normal trance states. Um, if anybody interacts with teenagers frequently, and if you ever see one on a phone, you're going to be able to see a trance state right in front of you happening. I've got two teenagers myself. I get to see them in trance, throughout the day. It's quite lovely. Um, so as I'm talking about that, can you think about areas where you all kind of are in trance throughout your day? I could give you more examples, but I don't know if anything comes to you.
Well, the phone stuff is really striking to me because I feel like so many people walk around on their phones or you're, disconnected from where you're at on your phone. And so that to me is the
Yeah.
most notable that I hadn't thought about before.
There's I can't remember the city, but they had to pass a law about people walking with their phones um, because too many people were walking into traffic.
Wow.
It's a thing because when they're in that trance, the outside world fades away. It's a natural part of it. It's just not the time to do it when you're kind of like walking through a busy street. So anyway, that's a common example. A lot of people go into trance when they run or when they exercise, watch a movie they really like, things like that. It's happening all the time. And so what we're doing with hypnosis is um, we're just teaching people how to do something on purpose that they naturally do accidentally throughout their day. And because of that, when you're teaching someone hypnosis, they usually don't experience it as anything kind of like they're expecting this weird, crazy experience, entertainment hypnosis side of things. And what they get feels very natural, very comfortable, and very normal, and very normal. So, any questions about that part of it?
I was curious how something like EMDR, like where would that be on the spectrum of would that be
Yeah.
considered hypnosis?
Yeah. So I want to say that EMDR does not officially call themselves hypnosis. That being said, my opinion, and this opinion is gathered from, learning a little bit about EMDR. I don't use it personally, but then knowing many clinicians who are extremely knowledgeable about EMDR. These are people who are EMDR trainers, and also have a lot of experience with hypnosis. So they've been trained in both. And across the board, every single person I've talked to that is trained in both has all said you could probably consider EMDR a subset of hypnotic techniques. It would kind of
Gotcha.
fit under that umbrella.
Oh, interesting.
Yeah,
So how does it work when are there different methods that people use to get into hypnosis or what does that look like?
that's fascinating. So because it's such a natural state, um, there's literally thousands of ways to get into trance. It happens so easily. Um, Even just during this call, if I spend a little too much time talking, one of you might dip in and out of trance just for a little bit. I mean, just think about like you're listening to what I say, and then Danielle, something I say strikes her as like, oh yeah, I remember. that time that, I was having this flare and da da da. And then she's like, oh, and then she pops back. She didn't quite hear what was said maybe for a minute, but then she's back online, right? So what just happened? She went into her own experiences, she went into her own memories and went into trance, retrieved those memories, kind of thought about them for a bit, and then popped out of trance and came back to the conversation. And so this is happening all the time. Oh, sorry, Danielle, were you going to say
Do
something?
you now, and I mean, and I don't know if you can answer this, but how do you do that less? And I don't
Yeah.
mean like always in like a conversation, but I feel, or like this kind of conversation, but I feel like sometimes like when I'm at the doctor's office, it's like he'll say something super intense that, gives me that same kind of feeling. And then it's
Yeah.
like any kind of logic is like gone from my brain to like ask him any kind of questions. So it's just kind of
Yeah.
like, how do you do that less? I mean, obviously, maybe I need to come speak to a psychologist, but um,
Well, but
yeah.
no, it's a really good question. So um, this goes back to what I was talking about with PTSD. So if someone's been through some kind of trauma, and there's all types of levels of trauma, right? There's trauma where there's really significant serious abuse and violence and things like that. But there's also the types of trauma that we're talking about here where people are in a flare, they're in incredible pain and discomfort, they're scared, right? This is can also be a type of trauma. And so if somebody says something that triggers you to begin to experience those feelings again, right? Um, the the brain has natural defense mechanisms to getting overwhelmed. One of them is called dissociation. So dissociation is where we kind of like pop out of ourselves, and there's different levels of dissociation, but one example of it is like somebody gets dissociated and they just kind of feel funny, they feel disconnected and almost like it's hard to think, and they're almost in a dream a little bit. They're almost apart from their body. Sometimes, if it's really extreme, it almost can feel like they're looking at themselves or watching themselves in the situation. These are all different levels and examples of dissociation, right? One of the nice things about teaching patients how to use hypnosis is that hypnosis also involves dissociation frequently. So, dissociation is not a bad thing, it's neutral. It can be used in healthy ways, but then if it's out of control, it can be a negative thing. So, often when patients have been through trauma, their brain is like using that dissociation in an unhealthy way to protect them from feeling overwhelming feelings. And so learning hypnosis is a way of taking that dissociation and moving it under conscious control. So that now what was happening unconsciously and automatically can be brought under voluntary control, because we can teach them, okay, this is how you dissociate. Let's practice. Let's go into a dissociated state. Let's come back out of it, and let's move it around, and let's not have that dissociation associated with so many negative, overwhelming feelings. So again, I know that was a lot of talking, but you're getting into the clinical stuff, so I'm getting really excited.
Well, gosh, it is exciting. Like it's just, yeah, I could just listen forever because it's new to me and it's just so cool that we can do that.
I,
Yeah, yeah. Go ahead,
oh,
Ashley,
I
please.
was just going to say, I like the way you framed or how you're saying how these, how it can be translated into a positive, like having something that's really difficult, like the out of
Yeah,
body experience and dissociation can, instead of like getting rid of it, you're training people how to use that in a way that's more effective or more, um, as a way of coping or dealing with it.
And that's a theme when we're talking about hypnosis. A lot of the entertainment stuff with hypnosis, the theme for that is being out of control or being under someone else's control, right? This is a common theme you'd see in movies and things like that. And in fact, the opposite is true. So patients come in and they learn hypnosis and they have more control over their mind. They have more control over their mind body interaction than they had before. Just like a patient coming in with that dissociation, we're not getting rid of dissociation. We're just teaching them how to control it. So we're bringing more of the functions of their mind under conscious control than they were able to in the past.
Yeah, wow, that's really powerful. So with the kind of would you say that trance is dissociation like a next level up from trance, or are they two different things?
That's a good question. Um, I think trance. Uh, you can be in trance and not be dissociated. Frequently, there is some level of dissociation involved in trance. So they don't always have to go together, but they frequently do. Um, because dissociation is a very useful way to get people out of their normal kind of conscious way of thinking about things. And this goes back to what you asked about what are the ways we help people go into trance? And I kind of was saying, hey, there's literally like hundreds, there's thousands of different ways because it's such a natural process. So as an example, one of them would be dissociation. Um, and this is just a silly example, but like if you were to like take your hand, and you could do this at night before you go to bed or something, right? You take your hand and just kind of stare at it, and then imagine there's a little version of you on your hand, just walking around, doing her thing, whatever her thing is, and you're just sitting there watching her, right? You would go into trance just by doing that. And that's an example of dissociation because you're putting yourself out there. Does that make sense?
So it's kind of like imagination, like
Oh, yeah.
imagining.
Yeah. Imagination. So, what I tell people often about hypnosis and about going into trance, really all you need are two things is concentration and imagination. And usually that's pretty much enough to go into trance. And this is why I say it's not very hard to go into trance. When we use our imagination, very frequently there's some level of trance also going on. And this is another area that I think hypnosis is a tremendous tool for people in general, because a lot of the struggles that people have in terms of their mental health could be put under the category of imagination misapplied. So, what do
Wow.
I mean by that? Think about an anxious person. What are they actually doing? They're thinking about the future, they're imagining some scary thing that's going to happen in the future, right? And they're doing it over and over and over, and they're doing it very intensely in a realistic way. So if I imagined, like before this podcast, I was sitting there imagining myself like screwing up and like saying all kinds of dumb stuff, and I did it, and I focused on that, how would I be feeling? Right? I'd be feeling pretty anxious. And I think a lot of people don't realize that they're doing that, first off, and they don't realize that it's their imagination that's doing it. So, so that's why I love clinical hypnosis as a tool to help with treatment in terms of anxiety and other problems, because you're teaching them a positive way to use their imagination in a way they've never actually done it before. So again, you're taking that concept of giving people more control over something that they were doing automatically.
That's definitely how I'm going to refer to my anxiety from now on. Just imagination misused.
Yes,
That's great.
yes,
Honestly.
yeah,
Wow.
Yeah.
So Dr. Navidi, like if someone isn't able to get hypnosis, like what
yeah.
would you recommend as a kind of like a first line of defense, if you will, to support their mental health? Maybe that's a really tough
Well,
question because I know it has to be individualized, but if
yeah,
someone were to leave this podcast and want to
yeah.
work on their mental health, like what would you recommend they kind of start with?
I think a nice solid place to start is there's a lot of good self-help resources out there. If for whatever reason, they don't have the time, they don't have the resources to come to like someone like us, like GI psychology, um, and they had to kind of figure things out on their own. There's a lot of good self-help resources out there. So, for example, um, there's an app called Nerva, Nerva. I think a lot of um, healthcare people have heard of Nerva. So Nerva is using, it's an indication of using hypnosis, clinical hypnosis for, I think it's designed for IBS, but it probably could be helpful for kind of general GI issues. Um, that's like a good intro. Like that would be a good starter for experiencing what hypnosis is like. Um, in a way that we know it's legit. Because if you just randomly look up like clinical hypnosis on like YouTube, you're gonna find all kinds of stuff. Um, but I can't say how wacky or on point it's gonna be. Similar to like cognitive behavioral therapy is a nice it's a nice place to start for your own mental health. And there's a lot of self-help options there too. There's a lot of good books. There's a lot of apps. Um, so as an example, I think I don't know how to spell this, but it's Mahana is a CBT that's been adapted to be gut focused, right? So that's an example of that. Obviously, with the apps and things like that, there's a lot of disadvantages to using it, and they're kind of limited. But it's a great way to get started, and some people can get a ton of benefit from them. Some people will get like a little bit, and some people it won't really help them much at all. um, because they don't adapt to you as a person, right? Um, there's compliance issues in terms of humans are terrible at following through with things on their own. It, it's just the way things are. So there's a lot of people that will do a session or two, let's say on an app, get distracted by something else, and then never get back to it, and that happens a ton. Um, and there's other kind of limitations. It can't change the treatment. It can't focus it on the things that you care most about and other things like that. But it's a good place to get started.
That would be, like you said, like a good starting point. And then for that specific care, honing in on someone that's close to you to get that kind of support. Ashley, have you ever looked at the Nerva app before?
I've heard it mentioned all the time, but I've never
Mhm.
actually looked at it. So I'm definitely going to check it out.
Yeah, let's take a peek at it, definitely.
Yeah, we
Yeah,
should
and
add
it's
that in the.
legit. It's legit. The people that have made it are clinicians. They know their stuff, so it's not a bad. Dip your toe in the water if it's something that you're interested in. It's not a bad place to start. And a lot of the patients that come to us have tried the Nerva app before, right? So it's a nice place to you also learn about what hypnosis is like, you know, without having to pay too much money and being able to kind of be in control of the experience.
That's a great starting point then for people if they're just wanting to kind of dip their toes in.
Yeah, yeah, exactly.
So you mentioned early in the the podcast that there's only 400 people worldwide doing this. So do you feel like we're kind of at the beginning and this is a field that's just going to continue to expand? Because it seems like it would be so beneficial for every patient dealing with, IBD or, a lot of these GI, gut brain connected disorders.
Yeah, I think we're at the beginning of a big shift in the landscape. I think it's becoming much more accepted and understood, and um, and that really is the driving force for why we created GI psychology. That the practice again, because we wanted to train more gut psychologists. We wanted to train more of them. And then we also wanted to educate professionals like yourselves, doctors, nurses, physicians assistants, get dietitians, get the word out that these treatments are available for patients, because we haven't spent very much time at all going straight to the patients. My thought has always been that there's a number of hurdles for people to accept and understand what this treatment's all about, and that it would always be easier to educate the doctors, the professionals, dietitians, physical therapists, whoever, educate them, and then having through that trusted relationship explaining it to your patients, right? I don't know if that's the right way to go, but that's the way we've always approached it.
Yeah, that's great. So is there, where, if someone is interested in working with you or your team, or providers that are interested in referring patients, where can they find you or get connected to the work that you're doing?
Yeah, so we have a pretty straightforward website. It's just gipsychology.com. So yeah, gipsychology.com. And then we've actually got clinicians who will do a free phone consult. So they'll answer questions, they'll explain how the treatment works, they'll talk about the costs, they'll go through all the logistics for no charge. For the providers, we actually created, because we've partnered with a lot of, because we're so specialized, um, we always see ourselves as this very specialized treatment that can kind of slot in and be a support for other practices, right? So what we did was we created this HIPAA compliant portal, and we call it our warm handoff. And so with the patient's permission, the provider can just enter in their name and contact information, and then our admin will follow up with the patient. Um, and we've been noticing that a lot of the healthcare professionals are using that, because what they find is that we're just lowering the barrier a little bit, because now instead of it having to be something the patient needs to remember and then kind of go and do, our admin are just following up with them, and it just kind of makes follow through a lot more reliable.
It's a lot better than the traditional faxing referrals.
Right, right. The old school, get that fax in. Yeah,
Yeah, and we did one of those calls initially when we found out about your team, and it was super helpful to learn about just where we can fill in the gaps with our own patients. So if you're a provider listening, totally recommends getting connected with your team.
yeah. And they can just and just if you would put my my email or whatever, people can reach out to me, um, if they're a provider or even a patient, and we can, if it's a provider, we can talk about how to set that up, because um, associated with that also is this auto reporting feature, which I think is kind of cool. Again, with the patient's permission, we automatically will send the intake summary and the termination summary so that you as the clinician are kept up to date about what's going on with your patient.
That's great, and especially as a patient to know that your providers are on the same page, and you know
Yes.
that really is something that's missing in healthcare. So that's exciting that you guys do that.
Yeah, thanks. Yeah, I wasn't smart enough for that idea. That was one of our admin who's just really on top of it. She's like awesome. But yeah,
Oh, that's nice.
Oh,
That's great. Well, it's been such a pleasure to have you on here. I feel like I learned a lot, and I feel so encouraged and validated that this type of support is available for people with IBD like us and our patients. So thank you so much for the work that you do, and for sharing a little bit with our podcast listeners.
yeah, absolutely my pleasure. And I wanted to toss in there, and maybe we could we talked a little before the show started about this one article um, that was in the Atlantic, and I think it'd be really cool if we could make that available. I'll send you all the PDF um,
Yes.
because it's a really nice story of a patient with IBD who also had a disorder of gut-brain interaction going on also, and because of that was facing some really nasty medical problems. And it's a
Wow.
really cool story because they were really able to get a lot out of the treatment and really turn themselves around physically. Um, so it's a really nice story. And the patient was, brave enough to share their story with a reporter, which is never
Wow.
easy. Yeah.
Wow.
So it's really cool.
Yeah, that's amazing. We'll definitely put that in the show notes so people can kind of see some outcomes of what it actually looks like in practice.
Yeah. I appreciate that.
All right. Well, thanks for being here.
My pleasure.
yes, thank you, Dr. Navidi. And I'm glad we're able to have this conversation. This is fantastic. And for everyone listening, let's continue to have this conversation.
All right.
Great.